this August House of some recent developments pertaining to Indians stranded in Iran as a result of the coronavirus situation. Before I come to the Iran situation, kindly allow me, Honorable Speaker, sir, before I come to the Iran situation, kindly allow me, Honorable Speaker, sir, to describe the larger global landscape with respect to coronavirus and our approach in responding to this international challenge. As all honorable members are aware, the global spread of coronavirus is now real and serious. Yesterday, the WHO declared it as a pandemic. As a country whose citizens are spread across the world, this is a matter of utmost concern. At the same time, it is absolutely essential that we react responsibly and soberly. What we say and what we do should address problems, not spread panic. It is natural that there would be situations of different degrees of gravity in different parts of the world. As a government, we will assess these in terms of their urgency and seriousness and respond accordingly. As the House would have noted, where specific interventions are required, as in the case of Wuhan in China, the Diamond Princess crew in Japan, or now the pilgrims in Iran, we will take necessary action. But these are exceptional situations that require exceptional response. At this time, travel in itself is not recommended as it only heightens risks. Where communities are understandably anxious, we should reassure them and encourage the observance of globally recognized precautions and procedures. An excessive sense of alarm would only be to the detriment of those who are really in need. Let me, sir, now turn to the issue of Iran. As per available information, there are about 6,000 Indian nationals in various provinces of Iran. These include 1,100 pilgrims, mainly from the Union territories of Ladakh and Jammu and Kashmir and the state of Maharashtra, nearly 300 students, primarily from the Union territory of Jammu and Kashmir, about 1,000 fishermen from the states of Tamil Nadu, Kerala and Gujarat, and others who are on longer-term stay visas in Iran for pursuing their livelihood and religious studies. As government started receiving information about the spike in coronavirus cases in Iran, as a precautionary measure, direct flights between India and Iran were temporarily suspended with effect from February 27th. Advisories were issued to avoid travel and returning passengers started to be screened. This is an ongoing exercise. Our embassy in Tehran and consulates in Bandar Abbas and Zahedan are naturally reaching out immediately to Indian nationals in Iran and ascertaining their welfare. An advisory was issued asking our nationals to observe appropriate precautions. Emergency contact details of the Indian mission were put out. Embassy and consulate officials have been reassuring Indian nationals and ensuring that they are in good health and had adequate provisions. I mention this as an overall approach, but also with specific reference to the fishermen community whose welfare has been raised with me by some honorable members. Given the large number of Indians in Iran, it was natural we should seek to sequence the return, taking into account their location and exposure. The initial focus is on visiting pilgrims. Many of them are in Qom, where coronavirus incidence has been very strong. The nature of residency also increases the risks of exposure, and age is a factor to be taken into account. As their welfare is being currently addressed, we are now focusing on Indian students. Many of them are studying medicine and are fully aware of the precautions to be taken in this difficult situation. The embassy is in regular contact with them as a group. Our understanding is that the region where most fishermen are located has not been affected so severely. These factors will guide our approach in the coming days. Over the last few days, government has made focused efforts for the safe return of stranded Indians, given the scale of COVID-19 and its pressures on Iran's own resources. A team of 6 Indian health officials have been deputed to Iran in order to set up testing and sampling facilities there. The first batch of 108 samples were received in India on 7th March, These were tested, and 58 Indian pilgrims, 25 men, 31 women, and 2 children, who tested negative were repatriated in IAF C-17 special flight on 10th March. We have also received samples of 529 more Indians on this flight, which have been tested in the National Institute of Virology, Pune. So far, 299 of them have tested negative. Some more results are awaited. We continue to collect more samples in Tehran, and our endeavor is to ensure the earliest possible return of these after appropriate testing and screening. We are working with the Iranian authorities to operate some limited commercial flights to facilitate this early return. Our embassy, in cooperation with the Iranian authorities, is making arrangements for the medical care and monitoring of those who have tested positive. Our embassy staff and medical team are working around the clock under very difficult conditions to ensure the objective of earliest possible return. The House will appreciate their operational constraints given that there have been restrictions instituted for public health reasons in Iran. It is not easy to organize transport, accommodation, and other logistics, and the Iranian system is very stretched, but we do appreciate the cooperation in these very difficult circumstances. Honorable Speaker, sir, I visited Srinagar recently, and I took the initiative to meet parents of some of the students who are in Iran. Their anxiety at this time is completely understandable. I shared with them in detail the ground situation and sought their understanding. I assured them that the government would facilitate the earliest possible return of their children, and I would like to share with the House that the sampling of these students has begun today. Our consulate in Bandar Abbas are in touch with Indian fishermen who are in the southern provinces of Iran, including the cities of Asaloye, Chiruye, and Kish. Some of them have been visited and others would be soon. Provision of essential supplies to them is being ensured. As per available information, all of them are in good health. I assure the House we will continuously track their welfare and respond to their needs. Sir, the House will surely appreciate that few other nations have done what we have with respect to end COVID-19. The global coronavirus situation is being monitored on a continuous basis by a group of secretaries headed by Cabinet Secretary and by a group of ministers headed by the Minister of Health and Family Welfare. My ministerial colleague has already apprised the House of measures being taken to control and contain the spread of virus within the country. Prime Minister himself has reviewed the situation from time to time. We have been regularly issuing travel advisories and visa guidelines that reflect the situation in countries of concern. In many respects, India has been ahead of the curve in taking precautionary measures. Sir, the House should also be aware that in view of the further spread of coronavirus, the government decided yesterday to take more stringent measures in regard to international travel. The reason for this is obvious. All the cases so far have come directly from those who have a travel history. In doing so, we are very clear that we will do whatever we must to ensure that the spread of coronavirus is restricted and that the health security of India is ensured. Let me spell out some of the measures that the group of ministers at a meeting yesterday approved. They will come into effect at 1200 hours GMT on 13th of March at the port of departure. These measures, sir, include 1. All existing visas except diplomatic, official, UN, international organizations, employment, project visas stand suspended till 15th April 2020. 2. Visa-free travel facility granted to OCI card holders has also been kept in abeyance till April 15, 2020. 3. All incoming travelers, including Indian nationals, arriving from or having visited China, Italy, Iran, Republic of Korea, France, Spain, and Germany after 15 February shall be quarantined for a minimum period of 14 days. It was also decided that any foreign national who intends to travel to India for compelling reason may contact the nearest Indian mission. Indian nationals are strongly advised to avoid all non-essential travel abroad. On their return, they can be subjected to quarantine for a minimum of 14 days. International traffic through land borders will be restricted to designated checkpoints with robust screening facilities. These will be notified separately by the Ministry of Home Affairs. So, the situation in Italy is now emerging as a cause of great concern. I would like to share with the honourable members that steps in this regard have already been initiated. It has been decided to make provision for testing primarily for students and compassionate cases in Italy and collect samples for testing. A medical team is being sent there from India. Those tested negative will be allowed to travel and will be quarantined on arrival in India for 14 days. The challenge is growing by the day in Europe, and we will respond accordingly. We have appointed in the Ministry of External Affairs a senior official to coordinate our coronavirus response internationally. A nodal office is being established to speedily process requests for assistance that are naturally expected to increase from different parts of the world. There will be some pressing, some unusual situations, and we recognize that and we will respond to that. The details of the nodal office will be made available very soon. Honourable Speaker, sir, I am confident that the honourable members of this House will join me in commending the efforts of our medical teams, the officials of the Indian embassies and consulates, the Air Force crews, the Air India crews, and all those who in India are working tirelessly and selflessly to ensure that our people in Iran and other countries are safe and can return expeditiously. The coronavirus challenge will require a focused and sustained effort on our part, and we will keep the House apprised of developments. Finally, I would like to strongly emphasize that the government remains fully committed towards the welfare of our nationals in any part of the world, as well as ensuring the security and safety of our homeland. This has been the hallmark of our foreign policy. I thank you. Observations made by various honourable members. Let me start with T.R. Baluji's question about the fishermen in Iran and the arrangements which are made for them. At this moment, I want to assure you we have no coronavirus case among the fishermen, any of them. But they have had difficulties getting food and provisions. Our consulate is in touch. They will remain in touch. We will monitor that. We are setting up a nodal center to actually check their welfare and the welfare of other people. Anthony G raised the issue of no screening in Kochi. That is not my understanding. My understanding is that there was screening instituted in all international airports. We have tightened it since then, but I can assure you on behalf of the group of ministers that this is something which is very much on our agenda. Premachandran ji again raised the issue of tests. He also referred to people who are stranded at airports. So I want to assure you that we are today helping the people who are stranded at airports. We are preventing a sense of panic. And I also want to clarify, India has not imposed a ban. India has said that people from certain countries who are coming here, if they come here, have to go through quarantine. In certain cases, compulsory quarantine. In some cases, discretionary quarantine. And Indian citizens who are coming back, obviously will come back to quarantine conditions if that requires. Saugata Roy ji raised an issue again saying we are not issuing new visas. What we have done is, we have kept in abeyance certain categories of visas for certain countries where there is prevalence of coronavirus. We are not the only country that has done that. A lot of other countries have also done that. We were among the earliest to do it. But you asked what is happening in Korea, France, Spain and Germany. We have not seen the kind of crisis situation that we have seen in Wuhan, or we have seen in Iran, or we are seeing in Italy. So we have to prioritize. We have to see where the problem is more severe, what kind of people are affected. For example, pilgrims are affected because they live in conditions where the spread of disease is very possible. Students are affected because the dormitories are closed. So we also have to see where should we give the attention, where should the resources be given. So I think they will understand it. I would urge all honorable members to understand it as well. Shri Masoodi ji raised an issue about our response time in Iran. I would like to share, sir, through you with the honorable members that it has been a very difficult situation in Iran because their own system is under very severe pressure. We have hospitals are under pressure, testing facilities are not available. We first tried to get everybody help in Iran. When we realized that this was not happening, that is why we were required to send our medical team. Then we had to actually go establish a clinic in Qom. Then even that we had to shift to Tehran and ask people to go from Qom to Tehran because that was the compulsion on us out there. So there has been no lack of sensitivity to the situation of people, but please understand it's a very difficult situation in Iran and we are working on it. 58 people have come back. I expect maybe another 200 plus to come back very soon, and the numbers will keep increasing. I would also Shri Thomas Cherkodan again raised the issue of airports, which I have replied. Owaisi ji raised the issue of people who are stuck in Mashhad. It is at the moment we have one medical team operating in Mashhad, in Tehran. So we are asking people to come to Tehran for testing. We are asking people to come to Tehran for testing. And if there is a problem, we will find a way of reaching people in Mashhad. We will not leave them out there. That assurance I give you. TB Adenji raised the issue of virology testing centers. Shri Harshvardhan ji is here. He will in due course. Let me finish my list. So we are setting up more laboratories for testing. The numbers have increased, but I would like my colleague to answer that question. Shri Mehtab ji also asked the same question about testing centers. He will answer that question. Regarding tracking those who are coming in, that's a very valid point. I want to assure him there is a tracking procedure, very, very detailed tracking procedure. In fact, the group of ministers have seen every patient who has tested positive. We have tracked hundreds of people who have been in contact with that patient. So it is not that we are only quarantining. There is a very, very detailed tracking procedure in place, and it is because of that actually that we have been able to keep it to the limits that we have. Then Vasant Kumar ji raised the issue of fishermen who are in the islands. Again, I want to assure him we will make sure that they are looked after. We are regularly in touch. Their food, their water, the provisions will be given. Bhagwant Manji raised the issue of 30 students of Punjab who are stuck in Italy airport. I know the honourable member is concerned about students from his region, but I want to tell you there are not 30 students. There are many more from different parts of the country. For me, all of them, I need to find a way of helping them, of bringing them back. We are at it. Again, please understand, we can only bring them back if they are tested. They have to be tested. And to test them, we have started the sampling today because we cannot bring back untested people in very severe epidemic situations because I have the security of this country to worry about as well. Kanimori ji asked, can we set up a helpline? Yes, we will be setting that up. And where will you quarantine? We have identified a large number of possible quarantine centers. Till now, most of the quarantine is taking place in Manesar and close by. But if the quarantine numbers mount, we have already initiated an exercise in cooperation with different ministries and different state governments. So we have a much bigger contingency plan for quarantining. Again, I think Honorable Dr. Harshvardhan ji would be better in a position to reply. Finally, Adhir Ranjan ji's issue about Saudi Arabia. We are very, very sensitive to what is happening, particularly with our countrymen, our people who are working in very difficult conditions in the Gulf. So far, in the Gulf, the cases have been very limited. But we are very much on the alert because we totally share your concern that if situation becomes worse there, they will have to be a priority area. So it is very much on our radar.